what's up everyone? This is Dr. David Song at the Rehab Hero Clinic, and today we'll be talking about golfer's elbow. Now, I've been getting a lot of requests to talk about golfer's elbow recently on my Instagram page, so today that's what we're going to do. Golfer's elbow is also known as medial epicondylitis. It's actually a condition that involves your common wrist flexors. So even though the location of the pain tends to be on the inner elbow, it actually has more to do with wrist function than it actually has to do with elbow function. What we're going to do for this is first we're going to go over how to test for golfer's elbow. Now, two of the main tests that help to diagnose golfer's elbow is a resisted wrist flexion test. So for this test, what would typically happen is you get the patient to clench a fist and to flex the wrist as well. In this position, you would then resist wrist flexion, and that increased load on that common wrist flexor muscle group can re-trigger the pain that's experienced at the inner elbow. Likewise, since this is an injury of the common wrist flexor attachment to the medial epicondyle, other tests known for golfer's elbow is just to see if passive extension of the wrist will cause any type of inner elbow pain. The third test that you can also do is a resisted middle finger flexion test, where you get the patient to stick out their hand right in front of you and you get them to resist, and that can also re-trigger the inner elbow pain. So what do you do for this? Then what you can do is you grab a massage ball or a lacrosse ball, and you could do a light massage of the common wrist flexor group. To do so, you can support your forearm on your thigh or on a table or stool, and place the ball on a tender spot of that common wrist flexor group. Now, these common wrist flexors tend to be on this inner half of that forearm. So you'll find a tender spot first, okay, and then you'll compress the ball downwards into your forearm. Now, when you're doing this type of massage using the massage ball, you want to only aim for a maximum of 5 to 6 out of 10 pain intensity. From this position, we're going to do an active movement where we just raise the wrist up and then we extend it downwards. And what you should feel is the muscle flossing underneath that compression that you have introduced into that forearm. After you do about 3 to 5 repetitions on that spot, you can then roll around to find another location, in which case you'll repeat this exact same movement. You'll want to do this for around 3 to 5 tender spots. It really depends on how sensitive you are that day. Now, with the self-massage technique, you do not want to do this every day. That will just end up bruising the muscle and will actually prevent it from recovering optimally. So at the most, you'll be doing this 2 to 3 times a week, giving your muscle 48 hours to recover. So when it actually comes to the rehabilitative process of this muscle group, you actually need to start strengthening it. And of the different types of strengthening exercises, eccentric exercises have been shown the most effective for this type of condition. And you want to strengthen it in its function, and being called the common wrist flexors, you want to strengthen it in wrist flexion. So once again, you'll put your forearm on your thigh, or you'll use the support of a bench or table. You'll grab a weight. I have a kettlebell here, but dumbbells work just as well, or a large water bottle. From here, you're going to curl that wrist up as far as you can, and you can use your other hand to assist in reaching that top of the movement. And you're going to slowly lower that weight at a 5-second tempo. And when we say 5 seconds, we're talking about 5 Mississippi. So we're going for a 1 Mississippi, 2 Mississippi, 3 Mississippi, 4 Mississippi, 5. And then you repeat. You want to use a weight that does not re-trigger a high intensity amount of pain. So generally speaking, if this activity causes a 2 out of 10 or less pain, it'll be okay to do, but you want to honestly see how you respond. Everyone's sensitivity levels are different, so if you find that it flares up your symptoms, then you might have gone too heavy and you might have done too many repetitions. For this type of exercise, I like to do anywhere between 5 to 10 repetitions. And for my patients, when I prescribe it to them, I usually tell them to stop before it becomes painful. Because what we're trying to do is just strengthen tendons, but we don't need to push through pain. It's not one of those no pain, no gain exercises. Now, if you do feel flare up, it doesn't necessarily mean that you damaged the tissue again. It just means you pushed it a little too hard. So that's the first exercise we're going to do for those common wrist flexors. Now, The second exercise we're going to go over for the golfer's elbow is wrist supination exercise. So you can use a dumbbell, kettlebell, or you can use a hammer for this exercise. So what you're going to do is you're going to use your other free hand to support the kettlebell in a bottoms up position. From here, you're going to take about 5 seconds to slowly let that weight drop, and you should feel those forearm muscles fire up right away. Okay, so we're taking a 5, 4, 3, 2, 1. So those are 3 beginner exercises that you can do for golfer's elbow. If you want to learn more about golfer's elbow, please check out the rest of my channel. I do have other exercises on there. All you gotta do is check out our exercise library. Likewise, you can look at our Instagram post at Rehab Hero for more content relating to the elbow and forearm. I'll see you guys next time.